Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 40 new cases of COVID-19 in Windsor and Essex County. Of the 40 cases, 8 are close contacts of confirmed cases, 9 are community acquired, 2 are outbreak related, and 21 are still being investigated. We have had 14,478 cases since the beginning of the pandemic. 13,671 cases are now resolved, and 398 people are active at this time. There are 315 preliminary or confirmed variants identified in Windsor-Essex. Currently, 114 of our active cases are variants of concern. 18 cases are in the hospital and 5 people are in ICU. Our community has lost 409 people to COVID. Unfortunately, we are reporting 2 additional deaths from yesterday. A man in his 40s and a man in his 60s from the community have passed away. There are currently 12 active outbreaks in Windsor and Essex County, 7 workplace outbreaks, 2 community outbreaks, 3 school outbreaks. We currently have approximately 431 students and staff in isolation due to school-based COVID-19 exposures involving approximately 15 schools. And now for the vaccine update. A total of 119,024 doses have been administered to Windsor and Essex County residents. 106,546 people have received at least 1 dose. Regarding our mass vaccination sites, people living in specific postal codes who are age 50 years and older are now able to book their vaccine appointment. There have been some questions about why we are at 50 for hotspot regions when the province has announced 18+. Currently, hotspot regions in Toronto and Peel are moving to 18+ only. All other regions that have identified hotspots are following the ministry guidance, and that is for people 50 years of age and over. Postal code neighborhoods beginning with N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y will be able to book. When you attend your appointment, please bring proof of address, whether it be a driver's license, current utility bill, or other bill. Please note that whether you are booking online or by phone, the available appointments are the same. The call center does not have access to appointments outside of what you see online. If you're booking online, please go to wevax.ca, wevax.ca. You will be asked to enter your address, the municipality in which you live, Windsor, Kingsville, or Leamington, and your postal code. Alternatively, you can call the call center at 226-773-2200 and someone will be able to help book your appointment. If you do not have a health card number and wish to book an appointment, please call the on-call number, 226-773-2200 to book your appointment. For general inquiries regarding vaccination of COVID-19, please call 211. While we are making good progress with vaccinating our community, it is critical that we all continue to do our part to prevent the spread of COVID-19 in Windsor and Essex County. Maintain a 2-meter distance from anyone outside of your household. Wash your hands with soap and water regularly, or use an alcohol-based hand sanitizer. Wear a face covering in public spaces outside of your home. Avoid touching your eyes, nose, and mouth with unwashed hands. And stay home if you are sick and get tested if you have any symptoms of COVID-19. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Today marks the beginning of Ramadan, a month of celebration for many residents in Windsor and Essex County. Ramadan is an important time for those who celebrate and is an opportunity to connect as a community and connect with your faith. This is typically a time of gathering. However, minimizing the risk of COVID-19 must be prioritized as the pandemic continues in our region and in our country. Residents are encouraged to observe Ramadan while keeping health and safety in mind. Despite the administration of COVID-19 vaccine in Windsor and Essex County, public health guidelines still apply to individuals who have already received 1 or 2 doses of vaccine. The Windsor-Essex County Health Unit encourages residents to celebrate and pray at home with their household members only and connect virtually with others. Indoor and outdoor gatherings with individuals who live outside of your household are prohibited under the province's current stay-at-home order. The safest way for anyone to celebrate is by staying home and limiting contacts to household members only. It is especially important to stay home if you are experiencing any symptoms of COVID-19. In Ontario, mosques are permitted to open for religious services, rites, or ceremonies while limiting their capacity at 15% occupancy of any particular room in the building. In order to continue to prevent the spread of COVID-19, it is important that residents who are planning to attend a local mosque in person abide by the following public health guidelines. Must maintain a physical distancing of 2 meters from others, wear masks or face covering at all times while indoors, and if you are unable to maintain a physical distance from others. Do not gather outside prior to or after the prayers. Visit only one local mosque and follow the rules in place. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Good morning. I was wondering, I know Teresa mentioned the postal code hotspots and that right now it's just a few selected areas that'll be administering them to 18 plus. Are there any plans for Windsor to be sort of lowering the eligibilities for those areas? And is this something that the health unit is able to lobby, or is it just a straight provincial decision?
So we are taking our direction from the province. We do know that we are looking at all the hotspots and determining priority groups. And so based on initiatives that are, yet to occur, we may decrease lower, but it would be very specific targeted areas and different, targeted groups.
Thank you. And do you feel the zones accurately represent the areas of most concern in our region, those that have been identified?
So I can begin, but basically the zones that have been identified are areas that we have always been working with. So they do align with the data that we have and what we've seen through the pandemic. So we would say they're quite accurate.
Great, thank you.
Any questions from CBC?
Yes, I wanted to ask a little bit about the plan to keep schools shut down after the break. Previously, our local data showed little evidence of COVID-19 transmission within schools. Dr. Ahmed said that it was mostly happening at home. Dr. Ahmed, do you think that switching to online learning is warranted based on our local epidemiology?
Well, I think what we are seeing is an increase in our cases locally as well. We were planning to review our data and look at the evidence locally to make a determination for us, but the province has already made the decision for everyone. So while we're still looking at the cases increasing in the school population, we'll have to look really deeply to see what kind of an impact it has in the overall school-age children. And the risk is from 2 different places. So one, the risk is when your community cases are high, these cases will end up resulting in bringing case inside the school system and then spreading it further into the school system. That's one way. The other way is if there's only risk that's happening is within the school system, and then it can spread out into the community and then can spread into so many other places. So it is difficult at this point to say anything with certainty given what we know. We have many children, more than 600 kids currently dismissed, and we have seen some trend in the cases increasing in the school population, but not to a level that where we were forced to close the school last year. But something that we'll have to wait and see locally. But I think as a provincial trend, it is going in the direction where cases are increasing in the schools, and which definitely poses more threats, especially with the variants of concern. And probably that's what led the provincial announcement.
Thank you. I know you've both brought up limitations in vaccine supply many times now. Are you able to say how much vaccine we currently have on hand and when we're expected to get more?
I don't know the exact numbers for vaccine that's currently on hand. We did get our we did get a shipment of Moderna in the last few days, and we are using that. And then our next shipment of Moderna is slightly delayed, but we will receive it at the end of the month. But I think I've shared before that our allocation for the Pfizer vaccine is 10,500 doses every week. And with our mass immunization clinics, that's what we're basically using every week. And then the Moderna supply, we are using it for our mobile clinics and some primary care providers. So we're using all the vaccine we have. I don't know exactly when you're saying how much we have available. It's all already spoken for. So there's really not any extra that's available for anything outside of what we have planned right now.
Thank you. Given the current uptick in cases, I was wondering how things are going with contact tracing and whether there's any backlog that we're experiencing right now.
So with the case and contact management, we do have a good complement of staff assigned to that role. And in addition, we continue to get support from the province, and we also have the external agency that is helping us. So there's no backlog. We are attending and keeping up and following up with people within a day to 2 days.
Thank you very much.
Any questions from Blackburn?
Not today, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. We know that the province has made it so that people from any region can seek vaccination in any other region. So I'm just wondering if you can give us a sense of how much of our region's allotment might be going into the arms of people from out of the region.
I can start with that, and we do know that with the pharmacy rollout that we were allotted about 25,000 doses. We also know that approximately 4,000 doses were administered to people outside of Windsor-Essex County. In our mass immunization clinics, at times there have been people from outside of Windsor and Essex County. I don't know the exact numbers, but it was basically at a time when there was a discrepancy or a change in age criteria. So if Windsor-Essex had moved down and other surrounding areas were still at a higher age level, then people seem to access our sites. So I don't know the exact number, but I do, I do know the pharmacy one because we had looked at that specifically. But we do know that it does occur, and there's no restriction by the province. But I think we probably saw it more when there was a difference in age, people, age criteria among the different health unit regions.
And would you say did that make a significant difference in seeing members of our community not vaccinated because people from elsewhere were taking those doses, recognizing it is a provincial approach, we're all in this together and all that nice stuff, but I would say some local residents might be frustrated to hear that somebody from, say, Toronto had a dose here.
So it is a provincial strategy, and the province has always been pretty clear about that. And the other thing I want people to know is that as much as we have seen people access our clinics from outside of Windsor-Essex County, we also are aware that people within Windsor and Essex County have accessed vaccinations outside of our area. So I think that it's happening both ways.
And the local number, when you give us the totals of how many Windsor-Essex residents have been vaccinated, is that accurate to local residents only?
Yes, so our epidemiologist is able to pull specifically Windsor-Essex County.
Okay, thank you.
Any questions from AM 800?
Yes, Teresa, just in regards to the vaccination site, I believe 2 are currently operating 7 days a week. We're hearing that those 2 are going down to 5 days a week. Is that true?
We have been doing 5 days a week, and that will be maintained 5 days a week, pending any influx of more vaccine. But right now we know until, I'd say toward the end of May, that our vaccine is pretty stable and consistent at what I've described, and that would require 5 days a week.
So the 5 mass sites, those are operating 5 days a week?
I would have to double check with Windsor Regional Hospital because they run the Sportsplex in the downtown, and they've been doing weekends as well. So, but the WFCU and the 2 county sites, Nature Fresh and the Libro Center, have been basically 5 days a week.
Thank you. Dr. Ahmed, just want to get your thoughts on obviously the hospital numbers, a big jump compared to yesterday. Yesterday, only 6 cases in hospital. Today, we're at 18. Obviously, I know yesterday you said high alert. I guess those hospital numbers, are you hoping people are on high alert after hearing those hospital numbers and that jump?
Well, I'm not sure that if these are all our residents or there may have been some transfers, because we did hear that the province is looking for capacity in different hospital systems, especially from the area that are already have many ICU beds and hospitalization related to COVID. So they are looking to send some of these people outside of the region. So I'm not entirely sure at this time that if all of these cases are people who got sick yesterday or in a couple of days, or is it a transfer? So we'll have to look into it. But again, that's the concerns. That's the risk that we always have. That especially in the GTAs, what they're seeing is longer hospitalization and ICU stay with more sicker people, with younger people contracting COVID, and that has been a concern. And I, as I said before, we're hoping that we can avoid that and we can be in a better state. But we'll have to look into these hospitalization carefully to make sure that if they are truly our people or if they were transferred from other regions.
And finally, you mentioned Ramadan during your opening remarks. Any concerns, or will there be increased enforcement at mosques, for example, to make sure proper procedures are being followed?
Well, we do have our enforcement officers looking out at everything that's happening in and around the region. So they will be doing their inspection, recognizing that this is the time when many of our residents celebrate Ramadan and gather at the mosque to pray and to feel that community connectedness. So it is really important for everyone to recognize that we're still in the middle of a pandemic, and we have to follow all the public health guidelines to ensure the safety and well-being of everyone, especially our most vulnerable seniors and older people who tend to attend to these type of mass gatherings and the prayers for most of the part. So it is important that we take care of each and every one and make sure that we are doing it in a safe way. And some of the things that I mentioned in my speaking notes is touches on that we all need to take all those precautions.
Thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Yes, with regards to patients who are receiving vaccines from their primary care providers, is there a list of people recommended for that, or any time frame in which they could expect to receive those vaccines?
The vaccines that are going to the primary care providers, they're providing vaccines to their own patients, so they are arranging all of that. Was that the question?
Yes, so this isn't happening through the health unit, it's happening directly at doctors' offices?
Yes, so some of the primary care providers are giving vaccine directly to their patients. They are getting the vaccine from our health unit, so we're acting as like a vaccine hub, as we do with other vaccines for primary care. We provide them any publicly funded vaccine, so that's how it's being operated.
Okay, thank you. Are you aware of anyone who's received one dose of the vaccine and subsequently got diagnosed with COVID-19?
I'm not aware of that. I don't know, Roger.
Yeah, I think the definition should be clear that whether they contracted COVID after developing that immunity, or we are talking about receiving the vaccine and maybe a few days after developing the disease. The incubation period obviously comes into play, and that's where we will determine that if it's a vaccine failure issue or if it's just a timing issue where the individual was already incubating the virus and got the vaccine at the same time but still ended up in being that. The vaccine failure question, I don't think that I'm aware, at least locally here, that we have come across with any situation. So far, these vaccines are very effective in preventing hospitalization and deaths. So hoping that that continues and more people, when they're vaccinated, we should be able to get that in place and save everyone.
Okay, thank you. And one more question about the hotspots. I know that you guys are happy with, or at least the hotspot designated line up with what you're seeing. But are there any other areas that you think should be a hotspot?
Well, I think it's a simple answer would be all our region has seen the brunt of COVID-19 impact, and each one of these areas could be a potentially qualify for a hotspot from that perspective. The vaccine supply is a challenge, and as much as we want to target these hotspot areas with vaccine, but the supply is very limited, and if we even add more hotspot areas, then there won't be any vaccine to give to any of the regions. So I think we just have to be careful, and eventually we'll all get vaccinated, and until we get to a state where the vaccine supply is more than what we can administer, we can figure out and we can say, yeah, we need to add more priorities, we need to add more areas and give out the vaccine. But at this time, it's almost impossible even to allocate the vaccine that we are receiving in meeting all these priorities that are given to us by the province at this time.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Yes, when the health unit is distributing vaccine doses to primary care providers, is there a system in place for those physicians to say that they'd like a supply? Have they already been chosen? What's that process?
So the province did open up that opportunity for some primary care providers, and so as they have a list, or they have an indication of primary care providers that are ready to receive vaccine, they let us know who they are, and then we arrange for the vaccination and the coordination of that part of it. And as you know, all of the vaccines that are administered are entered into the COVAX system, and so all of the vaccines given in Windsor-Essex County are captured in that system. And so when we're reporting the numbers, it's for all of, capturing the primary care providers, the mass immunization clinics, and the pharmacies.
Are they giving out, is it AstraZeneca?
AstraZeneca is being given out, and as well we have some that are using some Moderna.
And And can you give us a sense of how many physicians we have right now in the region administering the vaccine, and as well how many vaccine doses each are receiving?
So I don't have the exact numbers, but we do have 11 primary care providers through the provincial, the designation there. And we also are working with the family health teams that we talked about previously, which we have about 7 or 8 of the family health teams. And right now we have 46 pharmacies that are part of the program as well. And sorry, I forgot the other part of your question.
How many doses are is each primary care provider allotted?
Yes, so because we are using Moderna as well, we are working within the allotment the province has given us, and we know that right now that they, regarding the 57 pharmacists and healthcare providers, that there's only a limited amount, like 100 doses each. But with our Moderna, we're able to kind of work that out a little bit and increase some doses, for that. But we're working with our health teams, and they might have a little bit more depending on how many people they can book. But overall, it's not a lot, but it really does help. Patients would have access to their physicians to get the vaccine, and the rollout is very good, because in the end, all of the physicians will likely be doing the vaccinations of their patients as we move forward. When I say move forward, I mean, after the initial vaccination, as we see that, the needs for vaccines, COVID vaccines in the future.
Perfect, thank you.
Any additional questions from AMA 100?
No, thank you.
Thank you, everyone.